Hi, my name is Samantha Basoko, and I'm a fourth-year student at the University of California in Irvine in the Public Health Policy program. I chose to do my project on bodybuilding.com, located in the USA, and I listed their website for you to check out some information on their company. The current program they employ is incentives for a fit lifestyle, basically to encourage their employees to lead an active and fit lifestyle. I'd like to complement that program, and my goal would be to provide annual on-site medical checkups and screenings to ensure optimal health, continual safety, and satisfactory job performance. Company profile. Bodybuilding.com has become the largest and most visited bodybuilding e-retailer and fitness website in the world. It was founded in 1999 by a then 21-year-old named Ryan DeLuca. He is the current CEO as well. Their mission statement is, "We help our visitors reach their health, fitness, and appearance goals through information, motivation, and supplementation." They have about 650 employees total among the Boise, Idaho headquarters and among the 3 warehouses in Idaho, Florida, and Pennsylvania. So total combined of 650 employees. They have 2 websites. One is a super site focusing on social networking for bodybuilding, people who are involved in bodybuilding and fitness. And they also offer a store with tons of products and for e-commerce and product information. Their products include 3 different areas. As mentioned, motivation. They have free fitness plans. There's a free body space, which is similar to like a MySpace or Facebook, but it's all centered around bodybuilding and fitness. And they also offer lots of products that would be in the area of supplements, different brands. They have over 6,000 products, 450 brands of supplements, and they have clothing, tanning supplies, accessories, everything centered around bodybuilding. They also offer a lot of information, free articles on fitness and health, and you can get like free fitness, like I said, free fitness plans. And they also offer a lot of like testimonials about people who have changed their life through bodybuilding and transformed their body. The jobs include warehouse work for distribution of products. They also have web designers, customer service. It's very important in their company. A lot of people order through email and phone. They order products. Also, there's marketing, human resources, and accounting. Country profile. In the United States, our total population is currently about 318 million. Life expectancy is 76 for males, 81 for females, and 7 out of 10 Americans die each year from chronic diseases, which are highly preventable. 1 in 3 adults are obese. The leading causes of death in the U.S. Ranked in order are heart disease, number 1, cancer, and stroke. In 2010, accidents or unintentional injuries listed 5th in the leading causes of death. Lifestyle factors causing premature death and influencing our health status include poor nutrition. We live in a fast food nation. There's a lot of preservatives in our food, and Americans eat a lot of processed foods. There's smoking is prevalent, excessive alcohol usage, obesity, and physical inactivity. The current U.S. healthcare system facilities are largely owned by the private sector, and 60 to 65% of our healthcare provisions and spending are government funded, which is like a public sector for like veterans, and there's Medicare, Medicaid, TRICARE for the military. There's also a children's health insurance program. The Department of Health and Human Services is the government's principal agency for health provision for the poor. The U.S. spends more on health care than any other nation in the world. In 2011, we spent $8,608 per capita. Most Americans have employer-provided insurance. In order to contact bodybuilding.com, everything is done on the web. The CEO is Ryan DeLuca. Human Resources Manager is Stacy McCullough. You can call the headquarters in Boise, Idaho. Number is provided. When I called the number, they asked me to send an email to service@bodybuilding.com with a request to forward to Human Resource Department. I obtained the name of the human resources manager, through their website. I actually wasn't able to speak with her, but I did speak to a customer service representative, and they ended up replying with a brief description of their company fitness incentive information on their program. So the goals of the workplace health promotion that I would like to implement at bodybuilding.com, my goal would be to complement the current fitness incentive program by providing annual on-site medical checkups and health screenings with a local physician. And so our goal would be to maintain optimal health, continual safety, and satisfactory job performance. The importance is for doing this would be primary and secondary prevention, because a lot of times people with no symptoms often skip annual physicals, cancer screenings, and routine blood work, which the early detection is known to improve the prognosis of patients. It would save lives, and it would also save money. The benefits for the company would be to promote a good corporate culture, which involves employees that respect their company and understand that their company is out for their best interest. That's always a good thing in a company, is for the employee to feel like a self-connectedness with the company, that the company really cares about them. It combats presenteeism, it reduces absenteeism, and it maintains productivity in the workforce, and it reduces health costs because it's focusing on primary rather than tertiary or quaternary prevention, which once it gets to that level, if there is a problem, then they all are just treating the symptoms. Employee benefits would be early detection of health issues. So they're detecting everything early if there is something wrong so that they can have a better prognosis. It's going to ensure their optimal health. Like I said about the corporate climate, it increases trust in their employer. It's going to save them money in the long run, and it's going to reduce stress because they're going to know that they're in good health and that there's no underlying condition that they don't know about. Assessment of health and culture in the U.S., hypertension or high blood pressure is a silent killer. It often has no outward symptoms. Hypertension is a major risk factor for cardiovascular disease, heart attack, kidney disease, and stroke. 1 in 5 people in the U.S. don't even know that they have high blood pressure. And also, as far as cancer is concerned, there's a genetic risk now known in the medical community for certain cancers that you can get screened for by doing genetic counseling. The highest incidence of cancer in the world is in North America, and the fact that the American culture thrives on convenience and ease of accessibility of services like fast food. So bringing this to their company, the physician is actually going to make it easier on them. Healthcare stats in the U.S., like I mentioned, the U.S. spends more on healthcare than any other country in the world. So between 2000 and 2010, the number jumps from $1.2 trillion to $2.2 trillion spent per year. Emergency departments are often used as primary providers. People don't have a regular physician. They just treat symptoms that occur instead of working on preventative care. Emergency departments are always more costly than physician offices or outpatient care centers. And the reduction of healthcare expenditures can be achieved by providing accessibility of physicians as well as improving the population's lifestyle, which we are trying to do here at bodybuilding.com. So the goal, like I mentioned, was to be to complement the current fitness incentive program while improving the health of the employee by providing wellness checkups and health screenings for employees. There will be an anonymous survey that I recommend doing with about 6 questions, like when was your last physical? Do you consider yourself physically active, which would be like a minimum of 30 minutes per day? How often do you participate in the company fitness programs, number of times per week? Leading cause of absence at work, behavior that you engage in that you would think is put your health in jeopardy, and then would you agree to do the on-site anonymous physical, yes or no? Health promotion implementation, primary and secondary treatment involve both preventing disease and health issues, and early detection always results in a better prognosis. Of course, there will be optimal health and less expenditures as a result. So I suggest researching local physicians who are reputable and choosing one who will be willing to do the on-site exam. Once the surveys are assessed from the employees, have a company meeting and introduce the idea of a one-day event held within the next 30 days with the chosen physician. Provide incentives. I recommend doing something that's going to promote health, which would be like a $100 credit towards your products at bodybuilding.com. And post websites on break room billboards, health topics related to preventative care. Provide information for employees about the physician that will be coming. Offer an alternative option if an employee doesn't feel comfortable getting examined at work, which would be by a reputable physician, but offer that option for them to go to the physician's office. Evaluation methods would be to track absence rates before and after the health screening and physical, conduct the same survey, omitting the 2 questions about physician visits. And my expectations would be more participation in the fitness incentive program, improved job productivity, and less absenteeism. To measure feedback and reporting, conduct a more in-depth health survey with incentives after they complete it. Compare data each year. Conduct brief interviews to assess the overall impact on the employee's health. When the company expands, I would recommend hiring maybe a health promotion program manager to employ this and to employ other programs as the company grows. In order to report, call the headquarters in Boise, Idaho, and schedule a meeting with the human resources manager. Provide information from surveys and statistical data. My opinion about bodybuilding.com, I'm a huge fan. Bodybuilding.com offers a great incentive program to their employees with fitness challenges, gym membership reimbursement, fitness education rewards. Based on the website, there's a great deal of value placed on fitness and health. I've actually ordered products from them myself. Employees greatly benefit from the atmosphere of peers who engage in an active lifestyle. Everyone pushes each other. It's a practice what you preach mentality, whereas they're selling a host of nutrition and fitness products, and they're practicing what they preach by living the lifestyle and employing what they sell, basically. Body space profile is awesome. It's highly effective for the employees and community if the employees decide to participate. I believe that you'll see an increase in productivity. Employees will see an improvement in health and job performance. Of course, you can improve upon the health promotion program by increasing the programs available. Explore new ways to complement and keep the already effective fitness program vibrant. Offer healthy snacks and water. Adhere to break and lunch policies. And one of the key things with the work environment is to have a nature theme in the break room with plants and things like that, because it boosts the morale of employees. There's environmental psychology research done saying that nature provides like a therapeutic environment for employees. And other than that, here's my references, and thank you so much for your time.